Hello, my name is Barb Winters. Welcome to Today's Health. You know, Port Huron Hospital is absolutely committed to providing compassionate, excellent care for people with morbid obesity. In fact, since 2002, the highly trained clinical staff has actually provided care and support for over 3,000 people. Today we're going to be talking more about morbid obesity, and we're going to be learning some more about surgical treatment options. Joining us for this discussion is General Surgeon Dr. Karen McFarland. Dr. McFarland, welcome.
Thank you for having me today.
Well, this is such an interesting topic because it's in the news all the time, but I want to get started with just a definition of what is morbid obesity.
Well, morbid obesity really circles around three words, which is body mass index, and those metrics are really obtained by the life insurance companies. So obesity is by definition the weight of a patient in kilograms over their size or meters squared. So obesity starts at what they call a BMI around 30. When a patient ends up gaining even more weight, then they develop comorbidities like high blood pressure, diabetes, high cholesterol, and that's when it becomes a problem.
Why is it so prevalent in the news? Why are people talking about morbid obesity?
Well, one of the challenges, the CDC have been tracking obesity for the past 20 years. So between 1990 up until 2010, there's been a huge increase across many states across America, where more than 30% of the population are now obese, if not morbidly obese. And that's the challenge that we're trying to get to the bottom of.
Well, and as you started to tell us a little bit about, it's the health conditions that are associated with morbid obesity that are the problem. So what are the common ones?
Common ones we see in our clinic are particularly high cholesterol. Diabetes is a very big one because that determines which of the procedures that would be best suited for them. Sleep apnea, cancers are increased in patients with obesity. Not only that, would be many patients have swelling of the legs, or even increased risk of what they call thrombophlebitis, or with their veins causing problems for them. Infertility is a big one amongst even females, and what we end up finding out when they lose weight is one of the cheapest ways of getting a child within a year.
Well, that's very interesting. How does bariatric surgical treatment actually help the patient who has morbid obesity?
Well, we have to focus on really those patients who really have higher risks. So, for example, when we look at patients with sleep apnea, one of their biggest challenges is trying to get off their CPAP or BiPAP machines. Many of them would tell you that it's very uncomfortable to continue with that. And what happens, depending on which procedures patient obtain, they can lose anywhere between 10 to up to 30 pounds a month, and in a 6 months time frame lose about 100 pounds of excess body weight, and hence curing or even resolving most of their challenges, whether it be high blood pressure, diabetes, depression, and as a result they're off of even most of their medications.
Well, morbid obesity is of course a lifestyle problem.
Yes.
And so it will be a lifelong issue. So how can a surgical treatment help?
Well, we tell our patients, first of all, they need to make a commitment to themselves. It is a lifelong change, lifestyle change. This procedure is really just what we call a crutch, if you will, to give the patients the extra edge to get over the hump of doing things they couldn't do before. For example, playing with their grandchildren or with their children, doing golf or walking across the mall without feeling so short of breath. Those small gains are really big for many patients, and as a result, getting a new life, getting a new image, it is truly a blessing to see how patients improve.
Well, it sounds like you're a great cheerleader, and you're also realistic in saying it's not a magic bullet.
Exactly, exactly. And oftentimes that we have to overcome as bariatric surgeons is trying to give patients correct information. For example, you've seen many celebrities, some of who've had bariatric surgery, and it didn't go so quite well with them. And the bigger challenge is making sure that patients are appropriately screened. Knowing in advance it is not a magic bullet. And in fact, I can tell a patient how to cheat any surgery, which is what we call liquid calories. But the most important thing is identifying that obesity is not the cause, it is really a symptom of something deeper.
What surgical treatment options are available at Port Huron Hospital at this time?
Well, we've expanded our services to not only the adjustable gastric banding or the lat band, now we have room-wide gastric bypass, including sleeve gastrectomies.
Okay, well, we're going to take a break. When we come back, I'd like you to tell me a little bit more about each of these surgical procedures. First, we're just going to take a break.
Absolutely.